Delirium. What is delirium? It's a serious change in mental abilities, and it results in confused thinking, sometimes a lack of awareness of someone's surroundings. And delirium is usually comes on fast, within hours or just a few days. It can often be traced to one or more factors. Symptoms of delirium are sometimes confused with symptoms of dementia, but they're very different. Note that symptoms of delirium usually begin over a few hours or a few days, and they typically occur with a medical problem. Whereas dementia generally is a slowly developing problem and more consistent in the presentation. Delirium symptoms often come and go during the day, and that makes it even more confusing. There may be periods with no symptoms. You're trying to figure out if something's really a problem. Symptoms tend to be worse at night when it's dark and things look less familiar. They also tend to be worse in settings that aren't familiar, such as in a hospital setting. It can be very confusing since the symptoms do come and go, so it's incredibly important to get a thorough assessment and history over the past few days of the patient. And oftentimes, family and friends or just the regular caregivers are the best ones to ask because they've witnessed the changes. If you're a health provider, a nurse, social worker, chaplain, anybody, you see a patient move into delirium behavior, you must gather as much information as possible so the medical provider can treat appropriately. In the next video, I'll review a system of assessment that can help you gather the information. So stay tuned. Delirium is confusing, and we'll try to put some more information on board for you. Please visit our website, the Hospice Care Plan, and our YouTube site, the Hospice Care Plan, for much more information. Get our booklet to help your patients find care. Care is treatment.